Hello, everyone. I'm Traci Arieli, end-of-life doula and founder of Comforting Closure. Welcome to another episode. Joining us today is Charles Tigard. Charles is the director of Stanford's Office of Decedent Affairs, the very first office of its kind in the country. This remarkable team provides critical services and support to families during one of the most challenging times of their lives. In our conversation, we'll discuss why Stanford created the Office of Decedent Affairs, how they support families, and the larger impact of their work. So grab a cup of tea, find a comfortable spot, and join us for the conversation. Charles, welcome, and thank you so much for being here today.
Thank you, Traci, so much for having me. It's an honor to be with you today.
So can you tell us a bit about yourself and your journey to be part of Stanford's Office of Decedent Affairs?
And sure, I like that word because I definitely see it. It has been a journey, and I very much see it as a journey that I'm still on. I'm actually native to California, born in San Diego, raised in Riverside County, lived all over the country, including Pennsylvania, Vermont, spent almost 10 years in Florida during my pastoral work. So after college, getting a bachelor's in psychology, actually came back to California and kind of started my career in adult life. And moving back to California shortly thereafter in 1999, I started looking for my church in the head office and the denominational headquarters doing administrative work. And later on, that journey led me to seminary and getting obtaining the Master of Divinity degree from Claremont School of Theology. From there, continued my pastoral work, again, across the country, mostly in Florida. And of course, that work involved work, on occasion, working with church members who were at the end of life or who were very sick and providing a visitation, whether it was at home or at hospice or in the hospital. And then on occasion, officiating and planning funeral services for church members. And that was a big part of my work in ministry when I was in Florida, working with a community of older adults, and so often present in end-of-life situations, present when unfortunately one of the members of our congregation had died, whether again that was at home or in a nursing home or in hospice, so had a kind of a variety of experience in different settings. And then really chaplaincy was calling to me. I think part of that calling to chaplaincy was doing more of that work at end of life and at time of death. And typically professional chaplains working in healthcare settings, whether again that's hospice or in a hospital, they're really kind of a key link in that end of life journey and including at time of death. And so really went back to chaplaincy, did my training at UCLA Ronald Reagan Medical Center, spent a year there, and then from there worked for a short period of time for Dignity Health in the North State before coming to Stanford. And then was part, as you said, of creating this entirely new department and team at Stanford, which launched 2 years ago.
Can you give us an overview of what Stanford's Office of Decedent Affairs offers?
Absolutely. I think the first and most important thing to know is that this is family-focused, patient-centered care. And unfortunately, when a patient is approaching end of life, or unfortunately they have died, our caring doesn't stop. And so this department, this new team is really a continuation of that care, really under interdisciplinary approach. So working very closely, as I said, with chaplaincy, with social work, with our nursing teams, with the autopsy service, if that's something the family is interested in. So it's really very much an interdisciplinary approach to care, and really a family-centered approach. Unfortunately, when a patient dies, we become at that point their point of contact. So any questions, needs, or concerns that the family may have when the death has occurred, we are there. We meet with the family in person while they're in the hospital, and we do that for every case, every death at Stanford Hospital or Lucille Packard Children's Hospital. And then we're available over the phone to meet with families, to consult, to address any questions, needs, or concerns, and really to help guide and help them navigate this process. And obviously during a very difficult, heartbreaking time. We're meeting families on some of what might be the most difficult days of their lives. And then on top of that, they have to navigate what's next, funeral arrangements, etc. And we are here to partner and help them navigate that process.
That's a tall order because Stanford is a big hospital, and I've been to your office, and I know that it is a small to medium sized team. So you undertake a lot. So thank you. What prompted Stanford to create this service? That's something that's rare in a hospital.
Yeah, it really was a process, conversation with our leadership and stakeholders across the Stanford institution that really was nearly a 2-year process. So there were a number of things that happened. One is Stanford opened a new hospital in 2019 at 500 Pasteur Drive. The other thing, in addition to the new hospital facility, is that the Stanford healthcare system really is just growing across the Bay Area and beyond. And so part of that, and then during that same time frame, so 2019, a new hospital was opened, and in 2020, the pandemic happened. So all of those things happened essentially within the course of a few months. And then that summer of 2020, the hospital, both Stanford Hospital and Lucille Packard Children's Hospital, started a conversation with our high-level executive leadership on what we could improve, and part of around the space of decedent affairs specifically. And part of that assessment work was looking at what other academic medical institutions were doing across the country. So we reached out to other decedent affairs departments to understand what the best practices were, and then to identify what our opportunities were here at Stanford. I think one of the many things that's meaningful working here is our healthcare system is really is all about process improvement and what can we do better. As good as we are, how can we make things from good to great, yet the focus on our patient and family experience. And so I think this is key. Unfortunately, as we said, when a patient passes away, that what happens after that can impact that family experience. And so part of our goal, among many other things, is to make sure that the process is as smooth for the family during this difficult time as we possibly can make it to support that family.
I know that you were in talks before the pandemic hit. Do you think that the pandemic influenced or kind of sped up that process?
For sure. For sure. I think for all of us, and specifically in healthcare, when we are under lockdown, and for example, visitor restrictions were in effect during some of the toughest of the months during the pandemic, and unfortunately, patients were passing away of COVID. And in those early weeks and months, there was so much kind of fear and unknowns around the COVID virus. And now, of course, we know more. But in those early months, there were just a lot of unknowns. So absolutely, I would say that precipitated the conversation.
Now, I've been lucky enough to tour the office, and the environment is very different from the hospital that's right outside the door. Can you tell us about the environment that families encounter when they first enter the facility?
Thank you. So yes. So in January, we opened up an entirely new space that's dedicated just for families in bereavement. You have a few spaces, the family bereavement room, which is a private area just for families. And we also have a viewing area if families have not had the opportunity to see their loved one after the death. For example, maybe they're coming from a distance, they're coming from out of area, out of state, sometimes even international. We're able to accommodate that viewing in our facility. That space was really 10 years plus in the planning and really engaged stakeholders again from across the organization. So spiritual care, social work, the autopsy service, patient transport, hospital operations or facilities were all involved in the conversations and planning. Our art commission was involved in commissioning custom work just for the space. And so it's really a family-centered, private, very peaceful area. We have an amenity area for families with coffee, tea. We're able to give them privacy and dignity during a difficult time that, as you said, Traci, is away from kind of the busyness of the hospital. A private bathroom for families as well, so really designed to contain the family meeting or support the family meeting and the family viewing if that's what the family is requesting.
Yeah, it really does not feel like a hospital when you walk in there. It is a very calming atmosphere and supportive atmosphere. So, how large is the facility, the office, and how many decedents can you support?
We currently have 10 total team members, so a manager, supervisor, and coordinators. And I think important to know in the Stanford system, there are different sites. So there are different, morgue facilities at some of our different sites. So that capacity can flex as needed. Our facility on the Palo Alto campus supports Stanford Hospital, Lucia Packard Children's Hospital. It also supports the various research autopsy programs at Stanford as well. And then occasionally, we do autopsies on occasion, for example, for the Palo Alto Veterans Administration as well. So all of those have impacts on this one space.
How have you seen your services impact the families that you work with? Or does anything stand out to you or for you?
I think what I know is the impact has been significant. Families are very grateful to know that we are here to support, to partner, to help them navigate. Our goal is to provide comfort to the family during a very difficult time and also to provide clarity. Here are the next steps. Here are the resources available to you. Here's how we can support you. And really let the family take the lead in that conversation. Every family, what their needs and concerns are differ. So really, it's a family-centered, family-focused approach, letting the family take the lead in those conversations. Sometimes families have a lot of questions around next steps. And other times families, for example, they may have been at bedside, sleeping in the room for several days longer, and they just want to go home. And so there may not be a whole lot of questions at that point, but when they are ready, we are here to help and support. So I think a significant difference and just really another layer of support for family members.
I have two questions from that. The first one is, I know you're a chaplain, but you play a different role here. So, what role do you play, and your team members? When you said that we're all here to support, what kind of support is provided?
That's a great question. Yeah, so for every passing, we meet with the family on site. Typically, that's in the patient room. Sometimes if there's a conference room available outside of the unit, and that's appropriate, if the family requests that, we meet with them. And then we answer their questions, again, letting the family take the lead in that conversation. And we also provide written information that they can take home that's available in multiple languages that they can take home with them. So you kind of with an awareness that especially in immediate grief and loss, sometimes family members, for example, may not be processing a lot of information. So we actually provide it in writing for them to take home. And then, as I said, we're available over the phone for any questions. And then we really pivot to make sure that our staff, the nurse who's been taking care of the patient, that they're supported, that they have what they need, that they know how to document the passing in the electronic medical record. and then making sure that the physician as well has what they need to document the death, et cetera, in the medical record. We are an academic teaching hospital, so we have resident physicians that are in training at the Stanford School of Medicine. We have nurses that come from across the country to work here at the Stanford campus. So often a big part of our role is providing staff education. So family support, but also guiding our staff on what to do next, and being that navigator for families, but also importantly for staff. So again, that there's no impact on the family during this difficult time. And after that, those kind of two levels or multi-levels of support are completed, then we actually start the leaving death certificate with the state of California. So we access the medical record in partnership with the physician who's been taking care of the patient. Typically that's the resident physician. And then we start the death certificate record. And with the goal of having that record completed and signed by the physician by the time the family has made the funeral home selection. So again, with the goal of making the process behind the scenes as seamless as possible. Some other examples of our support is we provide coordination around autopsy consenting. Every patient in the Stanford healthcare system, Stanford Children's Health, unfortunately, if they die and they would like an autopsy at Stanford, we provide an autopsy free of charge. We do not charge families at all for autopsy, which is something very unique in our system and something that at smaller community hospitals or smaller systems is just simply not offered. Families always, of course, have the right to an autopsy, but that would be the family's responsibility to coordinate and potentially pay for the autopsy, which can be thousands and thousands of dollars. So it's something that we offer. Of course, it's the family's express right to consent or to decline autopsy, but it's offered for every case. So we initiate those conversations. And again, to make sure that the family's final decision is documented on the death certificate, but also in the patient's medical record. And then we provide all the coordination with the funeral home. So say, for example, the family has left. Let's say, for example, they're outside of the Bay Area. They've got home and they've made a funeral home selection. We then provide all of that coordination between Stanford and the funeral home as far as releasing the patient to funeral home care. So we provide essentially coordination from time of death all the way through the time we release the patient to the funeral home.
And I also know that you promote organ donation and brain donation also. Can you talk about that?
Yeah, so there are a number of opportunities, programs for donation. The primary one is through Donor Network West, which is the organ procurement organization, nonprofit, serving Northern California and parts of Northern Nevada as well. So it's Donor Network West would be the contact with families for example, organ donation or sometimes tissue donation. And absolutely, Traci, that's a good point. We coordinate that. So say, for example, the patient, and typically that's on someone's driver's license, they are a registered donor. And then Donor Network does an assessment, which is entirely independent of Stanford Healthcare. They do their own assessment, whether the patient is appropriate for organ donation or tissue donation, for example. And if that is the case, they are appropriate, they are an eligible donor, then Donor Network will reach out to the family for consent. Nothing in this process, very important to know, is done without the family's consent. And so Donor Network will reach out to the family will provide consent. Often that's done over the phone. And then Donor Network will send that consent paperwork to our office, the Office of Decedent Affairs, and then we coordinate. So for example, we don't want to release a patient, for example, to a funeral home if the patient has indicated that they would like to be a donor and they are appropriate to do so. So we want to make sure that the Donor Network is able to take those tissues that are life-saving for other patients before anything else is done. So we do all of that coordination between Donor Network, the coroner's office, autopsy, funeral home, etc. The other opportunity is the whole body donation program, which that's what you're referencing with those shows that you saw. So that's the Stanford School of Medicine whole body donation program, and you can find more information about that by using your internet search Stanford whole body donation program, stanford.edu, for information on how someone can pre-register. And that's important. We'd like individuals and patients to be pre-registered. That way, their wishes are communicated to the family in advance, and then that registration is kept in the Stanford School of Medicine system. And unfortunately, when the time of passing comes, again, it's a very similar process. The School of Medicine will do an assessment to see if the patient is appropriate for whole body donation, and if so, then they would be brought into the care of the Stanford School of Medicine.
We live in a very diverse area, the San Francisco Bay Area. How does the Office of Decedent Affairs handle cultural and religious differences when it comes to end of life practices that the families bring with them?
It's a great question. I think important to know is it's a patient's right and the family's right to have their cultural and religious needs met during their hospitalization. And that continues, as you said, through end of life and even after passing. So that is really done very much in partnership with, for example, the spiritual care service and social work. The ODA is part of that puzzle as well, but really making sure that the family's cultural and religious needs are met at end of life and then after. And really, again, assessing, meeting with the family, listening to what's important to them during this, very difficult time for some families. It's having a religious ritual that's accommodated maybe through their the leader of their religious community, or through a professional chaplain at Stanford Hospital, or some other families want to dress or clean, even comb the hair of their loved one after a death, and that's absolutely encouraged and accommodated as part of our process. And really, as I said, the goal and kind of the centerpiece of what we do is really family-focused care, and to make sure that those religious and cultural needs are met. Another specific example, sometimes in the Muslim community or in the Jewish communities, families want a quick, expedited religious burial, sometimes the next day. And so that's an important part of our support. We do the best we can to make sure that death certificate record is ready when the family wants to facilitate the burial. And again, coordinating not only the death certificate, but making sure that death certificate gets to the funeral home so the funeral home can file it, and the patient can be buried or cremated according to the family's cultural and religious needs.
You spoke about incorporating feedback from families, always improving. Can you share any changes or improvements that were made based on some of that feedback?
Yeah, absolutely. I think a few points. We're in contact with our families, so even after passing, we are still available. Sometimes we get calls a year or two after a passing with families wanting to know, how do I obtain the death certificate? We don't stop caring, and there's no time frame or time limit on when we're available to our families after a passing. Every family gets a follow-up call from spiritual care 30 days after the death, just to check in, to see how they're doing, to see if maybe they need a grief group referral or a referral to a local counselor, those kinds of things. So we're really checking in. Every family receives a survey just to give us feedback in real time on how we did, what can you improve, how can the communication between our physicians or nursing teams be improved, especially as you're talking about at that end of life, in those end of life situations. So I think that's important. I think a specific example that I can give you is in actually about a year ago, this summer, in August, actually, that we started an entire process improvement project around autopsy reports. So we talked a little bit about autopsy, and autopsy is offered for every patient. We've been able to pretty significantly improve the rates of autopsy at Stanford across both hospitals, the children's hospital and the adult hospital. So that's been an outcome of having our new department. And then the family, they know the autopsy has been completed. They've consented for the autopsy. The patient has been released to the funeral home, and the family is waiting for the autopsy report. And obviously, that's an important report that they want to review and often discuss with their physicians once the report is final. And so, in the previous state, the family had to request that through medical records, and there was a whole process. I don't know if anyone has ever tried to request your own medical records. It is a process. And so, and here in the context, in this specific example, obviously our families are grieving. Their loved one has just died. They want this report, but yet they have to follow these steps as part of our process, filling out an authorization to release medical records, etc. And it was to be in full disclosure, it was a pretty onerous process. And again, in the context of families who are grieving, and more than that, wanting access to this important information about their loved one. And so we engaged all of the stakeholders, including medical records, health information management services, in the Stanford system. HIMSS is the name of the department. And so we called in the autopsy service, we called in medical records, we called in the directors from across the organization, including some vice presidents in the hospital, to say, how can we do this better for our families? We can do this. And so we did. It took about a month of conversation and thinking the steps through. But now, in our current state, and that's been true, as I said, for the last year, and it's a permanent change moving forward, is when a family requests an autopsy, they are able to indicate, send me a copy of the report. And once the report is ready, the report is mailed. And so really to make that process as easy and, as I said, but less impact on the family during a difficult time. And then again, offering support, offering consultations with their physicians if they would like. The autopsy service is always available to meet with families, to set up a phone call or Zoom call to review autopsy results and to answer any questions that the family may have. But that's a specific example of a process improvement that's come out of our work.
I'm surprised it only took a month, because that's a very large change. And if anyone working with the hospital, they know, with the HIPAA compliance and a whole host of other compliance and legalities, it's not easy to change a process. So my hat's off to you. That's wonderful. And I love hearing that you're able to take care of families like that. So now we spoke just about that, and we also spoke about the death certificate. Are there any other important legal or regulatory aspects that families should know about when they're working with your team?
Yeah, I think there's a range of things that families and patients should be aware of. I encourage everyone, of course, to reach out to your legal counsel. There are folks in the community, the end of life doula community, and folks who are really expert in this field, and to really reach out to experts in the field for guidance. I encourage everyone to have a completed advanced healthcare directive. That's very important, to designate your agents for healthcare decisions when unfortunately an individual may be unable to do so on their own. I think documenting those things in the advanced healthcare directive and having those conversations with your family members, those you love, those that are close to you, those that will be helping, that we're no longer here. What's important to you? What are your values? What does end of life look for you or feel like? Or how do you envision that? And I know these are difficult conversations to have, but so important that we have them, to document it, but then also to talk it through. This is what's important to me. And when I'm gone, these are my wishes for donation, for cremation, for burial. There are all kinds of options. to remember a patient after they've passed away. So I think to have those conversations, to document them, and to make sure that that healthcare directive is taken to your doctor's office at your next appointment and scanned into your medical record. It's a document that you want to make sure is accessible to your medical team, but also your healthcare agents. So it's not a document. We had a situation about a year ago where someone had it locked in the safe at home, and the patient unfortunately was within the ICU, and they didn't have the key or the code. So it's not a document that it's a document that you want to have very accessible to your healthcare providers and to your agents.
Yeah. Thank you for mentioning that. I'm always talking about having those conversations. So I appreciate that. A few weeks ago, I spoke with someone from the National Home Funeral Alliance, and we were talking about some of the challenges that people face when wanting to have a home funeral. And one of those challenges was receiving their loved ones from the hospital. Does Stanford support that, taking and returning a person's loved one to their home so that they can do a home funeral? And is there a difference in what needs to happen in order to do that?
That's a great question, and this is something that the California Health Code does have regulations around. For example, transporting a deceased patient, and so I would have to do kind of more education on my part on how this would work. From what I understand, if it's in county, so for example, in the county of Santa Clara, that is an option for families, but to my understanding, to transport outside of the county, a permit is required. I mean, that it would mean either that they have an expert, like in the end-of-life doula community, who can guide them on how to obtain that documentation that's required from the county where the patient died, so that everything is done according to California Health Code. And so that's obviously very important to the hospital. So I am aware that there's a growing movement and fully support that. I think, my end of life wishes is to be at home with my family, not in the hospital, hopefully. So I think if those are conversations, again, kind of to back to your previous questions, that family members should have, how they want those last moments, that end of life. Is it in the hospital? Is it at home? Is it under hospice care? Is it in a private hospice setting? Again, I think those are very important conversations to have.
Yeah. Now, this type of work that we do can be emotionally challenging and very demanding. And I've always said that self-care is part of my job. It's just, I have to set aside time. It is just part of my job. How do you and your team cope with the emotional aspects of your work?
I completely agree with you, Traci, on that point. Self-care is not optional. I think now that I'm a little older and wiser in my life, I've learned that sometimes the hard way, that it really, sometimes we talk about it as, as a nice to do. It's not. I think around sustaining ourselves, taking care of ourselves personally, spiritually, professionally, navigating that work-life balance. I think specifically on my team, where you really check in with one another, frequent communication, or, do you have 5 minutes for me to share just what happened and how it impacted me? And really doing that as a team with one another, checking in, communicating, debriefing our visits after a meeting with the family, sometimes debriefing after a hard phone call, because, we're sometimes, as we said, meeting families that look basically really difficult days and moments for them. I think all of the self-care pieces around exercise, eating right, for me, and I encourage my team members, stepping outside of the office, getting some fresh air, taking in the beautiful, weather that is the Bay Area that we're so lucky to have, taking a walk outside, doing those kind of very practical self-care things as part of our team. We have a website or kind of an internal website that has different resources around self-care. We have a whole employee wellness program, for example, at Stanford that employees can access as well. So I think this is really important given the sensitivity of our work. And I think what I've learned around self-care is the sustainability. Like, I need to take care of myself today, but I also need to show up for the people I love, for the patients under our care and the families that we're caring for. I need to do that tomorrow and the next day and the day after that. So how do we make this sustainable in the long term and take care of one another? I think another awareness for me is, acts of kindness, deep listening to others and to ourselves. Body scanning, what's going on with Charles right now, listening to ourselves, especially after sometimes it's a more difficult visit, what's going on here, and do I need to take 5 to 10 minutes to step outside or to do something different? So I think that's really key in the space of Decedent affairs, but I think in healthcare, just across the board as well.
Moving from tech to healthcare, that's one of the things I really delight in, that there is this balance of, hey, we're giving so much of ourselves. We need to make sure that we're healthy to be able to do that. So it's really front and center in healthcare, which is great. So Stanford was one of the first hospitals to invest in this type of service. How have other hospitals reacted to this initiative?
We've received, actually just in the last few months, contacts from hospital systems in Ottawa, Canada. We received contact and meeting requests with their executive leadership for a system in Kentucky. And also we received a contact from the Children's Hospital, one of the children's hospitals in Pennsylvania. So we receiving contact from across the country. I'm sure that will continue. And really, they're doing what Stanford has done is reaching out to other institutions around best practices, what are the opportunities, and how potentially could they replicate a similar program. I think increasingly, especially academic medical centers, are adopting a decedent affairs model, having a dedicated team that's there to do this work. So that is an increasing trend that we're seeing across academic medical centers across the country.
This is the last question. How has creating the Office of Decedent Affairs changed you personally?
Good question. I think for me, it's kind of a tender place for me. I think for me, making sure that I spend time with the people, my family, the people I love, to tell them what they mean to me, how much I love and care for them, to never miss those moments. Because the thing that's true about death is once unfortunately death has happened, there's not another opportunity to say I love you again, or let me tell you what that meant to me, or let me tell you what you mean in my life. And so to take those moments, and I think even more than that, create those moments with the people that you love, to make sure that they're, that as best as we can, humanly possible, that the things that need to be said are said. That's so important. I think for me, as he is talking about planning, for me, it's making sure that I have a plan, that my plan is documented, and that I've talked it through with my agents for healthcare decisions, with family members who might be planning my service or handling the disposition of my body after I'm gone. So to have those conversations, difficult as they are and uncomfortable sometimes as they are, especially the people who care about us, and they don't want to think about the possibility that there might be a time when we're not here, but that those conversations are had and that we never miss those opportunities to create those special, sacred moments. I'll give you an example. My parents just celebrated their 50th wedding anniversary. And so we all, as a whole family, we went to San Diego, which is where they were married and where my brother and I were born. And so we kind of retraced our steps, 50 years later, and went to the church where they were married. And of course, lots of pictures. And went on a cruise, we did a cruise in San Diego Bay, and to create, and those that weekend, I will never forget, and they won't either. And so that is so important to me, and I think that in the context, kind of to answer your question of looking at death and dying every day, that to me has even become even more important.
Thank you. Thank you. And thank you so much for being here on the show today. I really appreciate it. Before we wrap up, can you share with our listeners how they can learn more about Stanford's Office of Decedent Affairs?
Absolutely. StanfordHealthcare.org, and you can search for Decedent Affairs there. We have a webpage as well, and StanfordHealthcare.org. I also encourage your listeners, Traci, to access their funeral bureau in the place where they live. There's lots of consumer associations that are out there. Lots of good information online around how to plan, how to have these conversations, resources and advocacy for families at end of life and at time of death. So I really encourage your listeners to reach out and to access those resources online.
Wonderful. Thank you. Folks, this conversation was very informative. Before meeting Charles, I had never heard about the work being done at Stanford's Office of Decedent Affairs. This work has the potential to set a new standard for how hospitals support families when their loved ones pass away. Thank you for joining us. If you have any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.